Right. So, welcome to our virtual baby shower with Count the Kicks and Healthy Blue Kansas. We're so grateful for their partnership to be able to offer this amazing event to Kansas residents. Again, my name is Megan Ockett. I am the program director for Healthy Birthday, which is the nonprofit organization that created Count the Kicks, our evidence-based stillbirth prevention program that you're going to learn a little bit more about today. So just a couple things that today we'll be talking about. We'll be talking about pregnancy and birth outcomes today. If at any point you feel uncomfortable or need to step away, please feel free to do so. If you have accessibility needs, please send us a direct message in the chat. You're all able to use the chat. Send us a direct message and we will do our best to accommodate. There are captions enabled if you'd like, and you can find those in the toolbar, whether that's below or above, wherever your toolbar is. We do have the chat function going. Sarah, my wonderful colleague over here, she's sitting across from me, that's why I'm pointing. She will be handling the chat and the Q&A, so feel free to use that, ask questions as we go. We want this to be very interactive. We want to make sure that we're meeting your needs and your questions. So feel free to ask those and we'll get those answered as we go throughout the time together today. I just want to spend a couple moments walking you through what to expect. What's the agenda for this time that we're together? So first, we're going to have a great introduction by our friends at Healthy Blue. We're going to go into a little bit more about Count the Kicks, how to use our app, the importance of it. We have some fun games throughout the presentation, like Guess That Price, similar to like a Price is Right game. We're going to hear from some amazing partners today in your state, including the Birth Equity Network, Douglas County Doulas, Child Care Aware, and then, of course, prizes. Everybody loves prizes, especially this close to the holidays. So we have the gift cards that are available for people, drawings for pack and plays, and all of that will be explained to you as we move throughout the presentation and what to expect after it is all done. A couple housekeeping things to get this boring stuff out of the way. So of course, you're automatically muted. And so if you do have questions, like I said, please use the chat function or the Q&A function. Our panelists here today will have their cameras on and off depending on when they're speaking. This is being recorded. And so after today, in a couple days, what will happen is we will send out an email with the recording, the slide deck, and more information on those giveaways that we talked about. So expect an email to land in your inboxes here within the next week or so that will come out. So again, we're so excited and happy you're here. And to start us off, one of the things that we love are babies, obviously. And we want to know, what trimester are you in? Are you newly pregnant? Did you just find out? Are you in your third trimester? Did you just have your baby? Go ahead and put that in the chat. And I'm just going to take a moment to see. Let's see here. Let's see. We got third trimester. Congratulations. Another third, second. Is anybody close to a December 25th baby? Are we going to have or New Year's Day baby? Yes, your microphones are muted and your videos are turned off. So, yep, you eat lunch, you relax, you do what you need to do.
Oh, Rachel just had a baby.
Oh, congratulations, Rachel. That's exciting. Awesome. Well, feel free to share throughout the time. We want to know what trimester you're in. If you happen to know the gender, let us know. That's always exciting too. We just hope you have wonderful, healthy, happy births, joyous experiences. So before we dive in, I would love for my friends over at Healthy Blue to go ahead and say a few words. Sharmikia.
Thank you guys so much. Thanks again for all the panelists and everyone for joining. I'm super excited for our first ever virtual baby shower with Count the Kicks and the entire team that we've gathered here today. Congratulations to all the moms, the new moms, the expecting moms. I have a 12-year-old and I feel like I'm in I don't know what trimester, but I'm definitely being born again in middle school and taking this all by the horns. So that's very exciting. I am representing Healthy Blue. We are an alliance partner with Blue Cross and Blue Shield of Kansas and of Kansas City, and we are super excited to be in the position to support the Medicaid population in the state of Kansas. So looking forward to more and looking forward to working with you guys and hearing about all the great things you guys are doing with Count the Kicks. Thanks so much for being here, everyone.
Thank you, Sharmikia. We really appreciate it and all your support. So with that, So many of you, it sounds like, are in your second and third trimesters, which is really exciting. One of the things that we know here at Count the Kicks is that a lot of times pregnancy comes with a lot of stress. I think we can all agree with that here, right? But we do have a program that can help reduce your anxiety. In fact, 77% of our app users, which I'll talk about here in a minute, have noticed decreased anxiety with use of our app. And then 84% of our app users noted that our app helps them bond with their baby. So what is Count the Kicks? What is this that I'm talking about? Count the Kicks is an evidence-based program designed to help parents just like you get their babies here safely. What we do is we educate expectant parents on the importance of tracking their baby's movement in the third trimester of pregnancy. So around 26, 27, 28 weeks, we want you to start tracking your baby's fetal movement. You might feel your baby move around that 20, 21 weeks, but tracking your baby's movement, paying attention every day in the late second, third trimester, that's where the app comes in and our tools and resources. One of the things I love most about our program is our empowerment. If you look at our materials, it's bright, it's colorful. We want to empower you as expectant parents to be your baby's advocate, to be your advocate. And that's exactly what we do. We give you the tools and resources to get to know what's normal for your baby in terms of movements and speaking up to your provider if you notice a change. So let's go into that a little bit more. We know that movement is one very important way a baby communicates before birth. We also know, and research shows, that a change in baby's movements can be an early sign, and sometimes it's the only warning sign that baby may give when in distress. So we really want you to pay attention to your baby's movement in the third trimester of pregnancy. So again, third trimester, that means 26 weeks if you're high risk or have multiples. 28 weeks otherwise is when you want to start counting your baby's movements, because this is when research has established babies have patterns. Babies start to get in those sleep and wake patterns just like you and I. And so that's when you can easily monitor and feel those movements. But what is a movement? We're obviously called Count the Kicks, but it's more than just a kick, right? It's a push, it's a jab, it's a swish. It's anything and everything except hiccups. Hiccups are involuntary movements, so they don't count towards the fetal movement, the baby movement count. So if you're a first-time mom, first-time pregnancy, and you're feeling your baby's movements and you're thinking, what is a hiccup? How am I supposed to know the difference between a movement and a hiccup? The way I explain it and describe it is a hiccup is very rhythmic, very consistent, like do would be like a hiccup, versus those like jabs, or sometimes you see like, you're like, oh my gosh, a foot is pushing through my belly or my rib, that type of thing. And feel free to ask questions as we go. So before I dive into a little bit more about our free kick counting app, which is available on the Apple and Google Play Store, one of the things that I want to do is share a video that highlights this tool in that way. And then I'm going to go into it and I'm going to ask you guys to download the app. So let's go ahead and watch first.
Whether you're counting on the go,
आराम से घबराइए मत.
your baby's movements matter.
Les mouvements de votre bébé comptent.
Monitor your baby's kicks, pokes, jabs, and rolls once a day.
Todos los días durante el tercer trimestre.
C'est l'occasion de communiquer avec votre bébé et d'apprendre ce qui est normal pour lui.
Bond with your baby.
Crea un vínculo con tu bebé.
सशक्त महसूस करें.
Sentez-vous autonome.
Confía en tus instintos.
Trust your instincts.
Ve al hospital de inmediato si los movimientos de tu bebé cambian.
L'application gratuite Count the Kick est disponible dans plus d'une douzaine de langues.
एप्लीकेशन डाउनलोड करें.
Or visit counttthekicks.org for more ways to count.
देर ना करें. आज से ही गिनती शुरू करें.
No tardes, empieza a contar hoy.
Ne tardez pas, commencez à compter aujourd'hui.
Don't delay, start counting today.
So what's great about our app, like you saw in that video, is it's one, completely free, but it's available in 16 languages. And in 2024, we'll probably add additional languages, getting up to 20. So how the app works is you download the app. So go ahead, take a moment, put your snack down, go into your app store, search Count the Kicks, and find that little yellow clock icon app, download it. Go ahead and register. That's really important. We want you to register. So signing in, naming your pregnancy profile, what your due date is, that type of thing. We don't sell the data. We don't share the data. It's completely private with us. We use it sometimes with research, but you mark that. Otherwise, it's our data. It's your data. You keep it. So how the app works, every day in the 3rd trimester of pregnancy, when you pick a time when baby's most active. So, or maybe it's 2 o'clock in the afternoon when that's the time you can sit down and focus on baby, or maybe it's 9 o'clock at night when everybody else is ready for bed and you finally have a moment to sit down. Whatever it is, we want you to do that time around the same time each day. So if I've been counting around 6 p.m. every night, I'm going to keep counting around 6 p.m. every night, because that way I'm going to start to build that trend, the average amount of time it takes baby to get to 10 movements. So how the app works, I sit down, I'm focusing on baby, I open my app, I feel that first movement, and I tap that footprint that you see there on your screen. As soon as I feel that first movement that I want to start with, and I tap that footprint, a timer starts at the top of that screen. So every time I feel baby move, I tap that footprint all the way until I get to 10 movements. Once I get to 10 movements, the app is going to go to a new screen, and it's going to ask me as the app user to rate the strength of those movements. How did it feel? How strong did baby feel? All the way from fluttery to fierce, 1 through 5. And so then I rate the strength of those movements during that session. And then one of the most amazing features of this app is after your session is done, you get a graph. So like that second image there that you see that's a little bit smaller, you get a graph that shows you how long it took baby to get to 10 movements and the strength of those movements. And after a couple of days, you start to see that graph build, and you start to see the average amount of time it takes baby to get to 10 movements. And that's really key, right? That should be a pretty linear straight line graph, little hills here and there, but for the most part, for example, this baby, the total time is 15 minutes from that last session. So the average time of those last few sessions has been around 15 minutes and 24 seconds. So if that's my baby, I know that's my average, and I can share this data. I can share it with my providers. I can share it with significant others. I can download it. I can share it on social media. There's a lot of things I can do with it, but the most important thing is just to pay attention to it. So if one day I'm counting and all of a sudden it took an hour and 15 minutes, what happens is that graph shoots up. So that would indicate to me saying, that's not my baby's normal. So I'm going to go in, I'm going to call my provider, or if it's after hours, I'm going to go immediately to the OBED, the emergency room, walk in, whatever it is, to get checked out, just to get checked out, because that's not my baby's normal. So again, it's completely free. We really want you to use this daily, every day in the 3rd trimester of pregnancy. You can set daily reminders so you never forget. You don't have to go into your own calendar. I know Sarah knows how busy we are. There's a lot going on between school and work and just everything and the holidays. So setting that daily reminder to always remind you to count is really important. So go ahead and download the app right now. I'm sure Sarah's busy in the chats, but we'd love to know if you've used this app, especially if you had your baby or you're excited to start using it. So the other thing that I wanted to mention, like, let's say you don't always have access to your phone that you can count on your phone. So we do have a web-based kick counter as well. So you can count one day on our website, which is, I'm sure Sarah will put in the chat. And then the next day you can count on your mobile device. So it's really up to you. It all syncs your data together. And then the other tool I wanted to share is, maybe you're more pen and paper person and you want to just manually enter the time and movement strength and everything like that. We have paper kick counting charts available on our website as well. If you'd be more comfortable using those versus an app, it's completely up to you. The most important thing is just getting to know what's normal for your baby and speaking up to your provider and sharing this with your provider. If your provider has not talked to you about the importance of tracking fetal movement, your baby's movement, go ahead and bring it up at your next appointment and say, hey, I heard about this app and this Count the Kicks program. I want to let you know I'm using this. What do you think? So really be empowered to say something to your provider, especially if they're not talking about it. The other thing that I wanted to mention that we have available on our app and on our website is this tool called Find Help. And so what this tool does, you can find it in the resources section of your app or on our website, our Healthy Birthday website, which I believe Sarah's going to put in the chat as well. You enter your zip code, and then what happens is you get shown free and reduced cost resources in your zip code, wherever you put that in. So you can search for diaper banks, you can search for childcare assistance, you can search for housing assistance, you can filter all those different ways. So this is another way that we can help you find resources and tools you need before baby gets here. So again, that's in our resources app. I know that we are just integrated into, what's that word? Like just involved with social media so much. Like we see it all the time. We're around it. Our other kids are around it. We use it for work probably. And I know there's a lot of common misconceptions out there. So one common misconception around tracking your baby's movements that I really want to address is, I have heard or I have read or my provider says I should get 10 kicks in 2 hours. So that's what I'm paying attention to. And so one of the things that I wanted to address here is that what we do, and we're based off research, and what we show is that we really want you to get to know what's normal for your baby. So if I'm counting and my baby, I notice after a couple sessions takes about 15 minutes, and then again, one day takes about an hour and 15 minutes, I can't think to myself, oh, but it's still within 2 hours because my baby's normal has been about 15 minutes the last couple days. So I'm going to go in and call my provider. Just like you don't want to compare your pregnancy to past pregnancies or friends. So if my baby takes around 15 minutes, Sarah's baby might take around 30 minutes to get to 10 movements. So it's all different. Every baby's different. Every pregnancy is different. So it's all about getting to know what's normal for your baby. And the app can help you track that. Counting your baby's movements can help you get to know what's normal for your baby. Again, with all the different social media and Google searches out there, making sure you have credible sources to learn more about positive birth outcomes in pregnancy. There's this one TikToker, her name is Jen Hamilton. She's a labor and delivery nurse. She does a fantastic job on her social media accounts addressing misconceptions around pregnancy and birth and prenatal care. And one in particular, a post that she did talks about the importance of count the kicks and monitoring your baby's movements. So I wanted to play this. Anytime you can share these messages, anytime you can watch these, go to our website. We're always sharing these credible sites and resources. Feel free to do so. But I do want to share her message with you all today as well.
Did you know that there's an app that can prevent stillbirth? Studies have shown that the most reliable indicator for an intrauterine fetal demise or stillbirth is a change or decrease in fetal movement. Getting to know your baby's movements and letting your doctor know if you have any changes is a great way to protect your baby. You don't need an at-home Doppler, and in fact, I would highly discourage you from buying one, because sometimes what happens is you can notice a change in your baby's movements and you can put on the Doppler and hear a heart rate and be like, whew, everything's fine. And if you were put on a monitor where we could see what your baby's doing, we would see fetal distress. This is a baby that's doing great. This is a baby that might not be doing great. And this is the baby that's definitely not doing great. But guess what? Every single one of them has a heart rate around 150. And with just hearing a Doppler, we don't know which one of these is your baby. There's a free app that you can download called Count the Kicks. It is a way that you can monitor your baby's movements, and it'll help you figure out if you might need to go get medical attention. I don't work for Count the Kicks. I get $0 for telling you about this. I just think that this is genius. They were able to decrease Iowa's stillbirth rate by 32% in the first 10 years of the Count the Kicks campaign. So please, take a few minutes each day and just pay attention to what your baby's doing. And if your baby's doing something wonky that they haven't normally done before, come see us. We would so much rather you come in, we monitor your baby, we maybe do an ultrasound, and we let you know that your baby's doing okay, than for you to not come in and your baby not be okay. You aren't bothering us, okay? We want you to come in. That's what we're here for.
So again, there's lots of great sources out there. You just need to find them. And she's one of those powerful advocates as a labor and delivery nurse.
Did you know?
So then I always want to end on another high note. This is baby Eva. She's a baby saved from Kansas. So this was submitted from a Kansas family. Her mom had said, A few days after my 36-week appointment, I noticed that my baby was not moving as much, and it was taking a lot longer than usual to get to 10 kicks. My next appointment was a few days away, and I brought it up to my provider. She ordered an ultrasound, and it was discovered that I had almost no amniotic fluid. I was sent to the hospital and induced the same day. My daughter was born September 2nd, 2020, at 37 weeks, 1 day. And although she's on the small side, she is healthy. So that is baby Eva. And so we want to give some time for any questions. And then one last reminder, if you ever feel like something is off, if your provider's office is closed, just remember that hospitals are open 24/7, ready to serve you. The risk of speaking up outweigh the risk of going in, and you always have the right to get checked out to make sure your health and your baby's health are okay. So I'll just take a moment and ask my colleague here if there's any questions in the chat or if you've answered them along the way.
I think so. Let's just reiterate about the third trimester of these.
The counting in the third
Mhm,
trimester.
mhm.
Yeah, so just to reiterate, to share again, we want you to start counting your baby's movements every day in the third trimester of pregnancy. So that's around 26 weeks if you're considered high risk, or 28 weeks otherwise is when you should really start to track your baby's movements. That's what research shows. You can really start to understand the pattern and track that trend of how baby's been moving. So yeah, third trimester, download that app, get those paper kick counting charts, and track your baby's movement. And then we'd also love for you to connect with us. Go ahead and join our newsletter, join our social media channels. This is where you'll get a lot of great useful information that you can share and know more about. So now we're going to play a quick game, and this is called Guess the Price of This Bundle of Baby Items. This is not an endorsement of these products, just some of the popular items that we pulled. So what I would need you to do is look at these 3 items together. So the Pampers diapers, those baby bottles, and then the ointment. And together, what do you think this would all cost if you were to go to the store and purchase all these 3 together? And go ahead and put it in the chat.
Without going over.
Without going over, the person who gets the closest will win one of our prizes today. So go ahead, take a moment, let's see, and then I'll tell you how much all these items cost and what the total is. So how much do you think Pampers diapers, a box costs? Tomo bottles, it's not something I had with my babies, and triple paste. And this is based off Target prices. So I'll give you 10 more seconds. Looks like we're getting, so all together, what do you think this costs? Should I do a drum roll? So total, all 3 of these items cost $90.97. So
without going over, it's
Jesse, congratulations. You will get one of the prizes that will contact you. If you wouldn't mind sending in the chat your email address to Sarah Coleman, we can follow up after this event. So just for your reference though, everybody, the Pampers there, that box costs $45.99. Those 2-pack, that package of bottles costs $23.99. And then the triple paste is $20.99. So together that was $90.97. So again, congratulations, Jesse. Go ahead and send your email directly to Sarah and we'll get you in touch with that price. So that's awesome. So now, oops, did I pause something? There we go. All right, I would love for Dr. Smith to join us on the screen from the Kansas Birth Equity Network to share a little bit more about her work and talking about Black maternal and infant mortality and a couple other great things to have that joyous birth experience. So Dr. Smith, go ahead and join us.
Thank you so much. Greetings and welcome to everyone who is in attendance, and congratulations to those who have little ones. I didn't know I was going first, but I'm grateful to be here to share with you some of the great work that we're doing in Kansas City and the Kansas City metro area. I want to give you a little overview of the Kansas Birth Equity Network and what we do. So next slide, please. Okay. So before I give you an overview, I want to tell you why it matters with the Kansas Birth Equity Network, or why we started this work. Next slide. So in the state of Kansas, for over 30 years, Black babies have been dying at 2 to 3 times that of white babies, while infant mortality has decreased. The disparities have not. And last year, in the latest data, Black mothers were dying at one of the highest rates in the nation within the first 42 days of delivery here in the state of Kansas. Next slide. So when we look at what's happening with Black moms, we can see that a lot of the social determinants of health were not really contributing factors to the outcomes that we were seeing. So it meant that housing wasn't truly, while it may be vitally important, it wasn't truly connected. Education, while it may be vitally important, wasn't truly connected to these outcomes. So Black mothers who are college educated fare worse than women of all races who never finished high school. And then Black mothers in the wealthiest neighborhoods do worse than white, Hispanic, and Asian mothers in the poorest ones. And one that was very interesting to our work and very concerning was that Black women who initiated prenatal care in the first trimester still have higher rates of infant mortality than non-Hispanic white women with late to no prenatal care. So this is the root of the inequities that exist, not just in our state, but across the nation. And so this is why this work is important to us. Next slide. So the Kansas Birth Equity Network is a community-centered approach. It's a community engagement core. It's a convening agency that brings together diverse stakeholders to create solutions that improve Black maternal, paternal, and infant health in Kansas through training, research, healthcare, and advocacy. What does that mean? We talk about this mission, we talk about our vision all the time. That does not mean that we only serve Black women, Black birthing persons, and Black fathers and Black infants. It means that we are intentional about serving them, and that they are our priority until these disparities are better, are reduced, are gone. But we serve all mothers, birthing persons, fathers, and infants in Kansas and in the Kansas City metro area now. Next slide, please. Our approach, initially we started with the Divine Nine, so engaging fraternities and sororities to increase awareness around Black infant mortality. And then out of that work was the Kansas Birth Equity Network was birthed. And we started that work by listening to you all, listening to parents, collecting those lived experiences and community voices. We have a parent support group. We have a barbershop initiative. We have our engagement, which brings together those 64 diverse stakeholders bi-monthly to create these solutions based on what's happening in our community. We also have some vaccine work that we do. We were instrumental in creating the first ever birth equity training. So really highlighting the voices of Black moms, Black dads in this work, as well as Black birth workers and their contribution to this work in our state. And then we host several events each year to create awareness. We are really focused on our ability to no longer define Black communities in their deficit. So one of the major goals of our events is to really highlight the strengths of Black communities, the strengths in the work that we do to improve those communities, and not continue to define them as deficits, but to really empower them so that we can improve our health outcomes. We have scholars training. So one of the things that we kept hearing from our parents was that they were not being heard. And so in order to address that, I proposed and we're in our second year of a birth equity clinical scholars training program. And it's really our opportunity to educate providers on how to provide equitable care in underserved communities. Next slide. Next slide. So throughout our training, we have really looked at these several areas of community engagement, of talking about bias and about the Black birth workers. And then as well as the most important module in this is really looking at respectful maternal care. And that means like being respectful in the care that you provide, being intentional. And so this is the outline of our overall curriculum. Next slide. This is how we engage our community because COVID started. So we used to be in person with our with our now board members. The Kansas Sisters and Brothers for Healthy Infants is still a very active group, but they serve as the board for the Kansas Birth Equity Network. But we engage our members on Zoom bi-monthly to create these solutions. Next slide. The way that we define birth equity is shifting the blame from women for poor health outcomes to system level accountability for programs and policies. And what that means is that we'll no longer blame women, birthing persons, for their outcomes. We will look at what policies, what procedures, what is the systems level approach, and how the system has failed our birthing persons in our state. Next slide. So to start this work, one of the things that our parents told us was that they felt our terminology was very inequitable. And so we started with our parent support group of about 11 parents. And the goal was really that we would mentor them to be a part of the larger group so that they would know that they were the experts in this work and they would enter that space as experts. But because COVID happened, we had a lot of conversations around fears, around daycare, around what they were having to do to survive that era of time. But we also had a conversation around terminology. And our patients told us that they felt like a lot of our terminology that we use in research or that we use in our communities is blaming. And so we wanted to create some equitable terminology to really talk about to our clinicians as well as our communities about how they describe our communities and how they can be more equitable. And so we're working with KU right now. We'll be working with other clinics, hopefully across our state, to really get them to implement these terms that are more equitable to our community. And they were able to tell us those terms. We were able to identify equitable choices, and they defined what the term actually meant to them. So being non-compliant meant that they really didn't have a choice in the decision making. And so we wanted to change that to low patient activation. How do we activate our patients to know that they are a part of the decision making when it comes to their healthcare and when it comes to them receiving social services in our community? Next slide. So as a beginning of KBN, the network, we needed to have a plan. We needed to make sure that we had an overall plan on how we were going to address these issues. Next slide. And so what we did in that first year was we developed a research agenda. And you may be asking, what does this mean? This is our solutions. It means that as a network, we will carry out the work needed to address each of these questions. And when I say network, I mean KBN and its members will carry out the work to make sure that each of these questions are addressed over the next 5 years. So this is our goal for the 5 years, and we would do it collaboratively. Really focuses on medical research questions, systems questions, and at the time we had COVID questions. Next slide, please. And so just to give you a little information about our events that we have every year, one of the important things for these events, and we've definitely had some sponsorships from Healthy Blue, so we thank you for that. But one of the important things about these events is that they are free. And we often provide daycare because we want you to be able to enjoy those events, but we want to remove the barrier of having costs to these events. So we have 2 events per year that are free. We have our Birth Equity Summit, and it includes a Birth Justice Walk, which happens in the morning, that says that we just walk in solidarity, that we will work together to create birth justice in our state, in our metro area. We have our summit, which increases the awareness of the issues nationally as well as locally. And we always have our parent conversations. So we want to make sure that we have the voices of parents within our work. And so that really helps us to do the work. And one of the things that we implemented during our years of COVID was the Black Baby Photo Contest. So each year we have a Black Baby Photo Contest, and usually the prize for that contest is really mother, birthing person centered. So we usually give something that the parents can use, but our first year we had a tie. We also had a tie the second year, but first year we had a tie with number who won, and then we always have a winner up. And so we have about 28 to 30 entries per year, and this happens per year, usually around September. So if you're interested, your baby just has to be less than 3 years old. And so we'd be happy to celebrate them. This is actually our opportunity to celebrate babies living past that first year. So it's Celebrate Day 366. Next slide, please. And so we also have a Black Maternal Health Week event. Last year we had about 130 individuals attend that. These have been virtual, but now we are doing more things hybrid. So you can either attend in person or online. So we like to have that option. We have vendors at this event. We have learning, we have free lunch, we have daycare, and we also had yoga. So it's really centered around having a conversation about what we were doing in our state around this area. So we had policy present, we had a foundation, we had a doctor, an OBGYN who's now studying to be an MFM, and we had a parent on the panel. So we always make sure that we have the parental voice in all of the work that we do. Next slide, please. This is our Birth Equity Summit this year. We're still working to download all of those photos, but this year we were able to bring in Dr. Shalon Irvin's mother. Dr. Shalon Irvin worked for the CDC, was a health equity advocate, and also lost her life shortly after giving birth to her daughter. And her mother has decided to take on the ability of educating and creating spaces for individuals to have peer-to-peer support during their time of pregnancy to make sure that no one else suffers from what her daughter suffered from. And so she was able to come and talk to us. We had a community panel with the community projects that we're funding through our Healthy Blue funds. And we also had myself who gave an overview of what we were doing as KBIN, and we had a poster walk. Next slide, please. So we were able to disseminate some of the work that we're doing in this work. Next slide, please. And please let me know my time. So we did a poster walk where all of our members were able to submit a poster to us, and to present that was free. We printed the posters with our funding, and then they were able to talk with those in attending about the work that they're doing around birth equity. And we're also able to give our first birth equity awards this year because of a private donor. And so this is just saying that we heard our patients. Next slide. And so one of the things that I talked about earlier was our scholars program. And the reason we have that is because we are really trying to change the system. So we really want to make sure that clinicians have the resources and training they need to provide this equitable care that we believe every person should have in our community. So our clinicians that enter this program, they are doing a 2-year fellowship, which they have to complete the birth equity curriculum. They have to attend monthly didactics to learn about policy, to learn about community work. They also have to complete a research project that includes mentors from their community, research, and clinician. They have to spend 40 hours a year at either a Black-led or a Black-focused maternal and child health organization learning about equity. And then they also have to advocate for maternal and child health policy each year. That could mean a letter to their legislators, but they also have to attend the Capitol. They have to go to Topeka to actually visit legislation in action and build those relationships. And so that is a part of the work that we're doing, because we really want to not just work with the community, but we want to work in all areas that are going to change these outcomes. Next slide. And so this is a picture of our first scholars and I think our first day in session. And so we had 5 scholars the first year. We also have 5 scholars this year, and they must apply, and they must have some past history and interest with working with underserved communities. Next slide. Next slide, please. So we also have a barbershop initiative. This is a very small project, but we've been working with 3 barbershops in August and 1 that we entered later. And these barbershop initiatives are really focused on postpartum, paternal postpartum anxiety and depression. So 1 out of 10 men suffer from postpartum anxiety or depression, but we ignore that because they're not a part of the maternal and child health conversation. And so we have developed a barbershop initiative around this issue with these 4 barbershops. It's been going pretty well. And we also focus on mental health support, blood pressure, cancer, diabetes, and COVID-19. Next slide. I want to talk a little bit about what we do, what's a benefit of our of being a KBIN member, because we talk to our members. We want to make sure that in this work is community centered, it's patient focused. And so we developed this patient engagement roadmap with some PCORI funding that just defines like the benefit of being engaged in this type of work. So while we look at the benefits of being a part of KBN, this is also the benefits that our community would have in order to remain engaged in this type of work. Next slide. We have parent support groups. Next slide. So we have our parent gathering circle that meets virtually, and this is for members of KBN and the community, so you don't have to be a member to participate in these. It's led by a doula and someone who is also training to be a midwife. So we're instrumental about working with our community members that have expertise to lead some of our programs within the community. This parent gathering circle is for you to ask questions, for you to get any help that you need, and it's for both parents to attend, and you can also have support members that attend. Next slide. We also are one of the partners on Black Dope Dads, which is here in Wyandotte County. It's led by CHC. And this is really a father support group for Black fathers. It's done in a hybrid manner. And so we also support this and partner with them to have something that is just dedicated to our fathers. Next slide. We have partnerships across the state as well as partnerships nationally. So we have a partnership with the Kansas Fourth Trimester Initiative. They take our curriculum. Their champions are able to take it, and we're currently working on how to implement it in every clinic to be available to every person in Kansas, because we really know that we need this education. We have a partnership with Dr. Shalon Irvin's Maternal Action Group. So if you are a member of KBN, you can have access to the Believer app. There are 2 Kansas rooms in there. One is focused on doula support, and the other is just overall parental support. If you're not a member of KBN, you can still have access to this app. It's just 99 cents a month, and there are 2 Kansas rooms in there that are active, and we're actively monitoring. We also have a partnership with the Journey app. This app is an app that you can journey your entire pregnancy, and it gives you any warnings, signs, or anything that you enter. You can look at your mood. You can look at your labs. This app is $35 a month, but because of our partnership, if you are a part of KBN, you can have access to this app for absolutely free. And it is a 2-year app, so you can have that over a period of time. Next slide. We are developing a vaccine website. Next slide. So one of the things that KBN is really focused on is taking current information and making sure that it is representative of the population that we serve. So we're currently working with our KBN members, a task force of those members, of about 12 of those members, to develop a vaccine website really tailored to Black communities in Kansas. And so we will be finishing this website at the end of this month. And so it will be launching hopefully in the 1st of January. Next slide. We have community project funding. So as I mentioned, Healthy Blue has provided funding for us to support our community members that are working on our research agenda and other gaps in our community that are focused on Black maternal, paternal, and infant health. And so we provide these fundings to our community members. Next slide. Next slide. Sorry. So we have funded some of those projects. So happy to say we had a laundromat initiative. And so you may not think that laundry is a part of like maternal and child health, but one of our members was doing a laundromat initiative that she would do during the week. And so we met with her about what if we were able to do a laundromat initiative that would focus on times that moms, birthing persons, dads are available to wash. And so we did a Saturday laundry day. We're hopeful to do another one. It was a major turnout where you got free detergent, free softener. We also provided snacks and pizza. And you got to wash 3 loads of clothes. And you also got a laundry bag. So if you didn't have a bag for your laundry, but it is very important that as parents that you have access to the resources needed for your family to represent itself well in the community and be clean. Next slide. We also were able to fund the SHOP project, which was a community health fair event that was done by one of our members. So really highlighted what was happening in our community, as well as having a conversation around fatherhood. and then also having health screenings. Next slide. We are funding a project around what your zip code means to you. This will be in Wyandotte County. So there will be a billboard that you can scan the QR code, and you can find out everything about the community that you live in related to these topics: hypertension and preeclampsia, diabetes, social determinants of health, and COVID-19. Next slide. We are also funding a perinatal mental health project, and this is to identify how patients and individuals in our community find out about mental health resources and education and where they get them from. And so this is a two-part project. Thank you. I also want to thank our team. There is a team that does this work. There is no way I can do it by myself. Aloma Obi, Erin Edeberry, Sharon Wolf, Shay Roy, and Bernard Schusters are a part of our amazing team. And this work happens because of these individuals. Next slide. So if you want information about what KBN does, or you want to be a part of KBN, you can scan this. You can also follow us on social media. We are, as you can see with this slide, we are not just an academic institute. We have community leadership as well as a part of the work that we do. Thank you so much for your time, and I hope that you look forward to joining us. Our meetings are on Zoom, so we'll be happy to have you. We'd also be happy to help you if you do not want to be a member and you have questions about parenting in our community. Thank you.
Thank you, Dr. Smith. That was amazing. I learned so much. What a lot of great resources and groups and parenting groups that you have available. So if there's any questions in the chat, Sarah's been monitoring them. I don't think we see any just yet, but feel free to add those. But amazing, amazing work. You and your team are doing amazing things. And we're just so excited that you could be here to share those pieces with this group today. Tons of great tools, like Sharmikia said. So thank you so much. And again, this whole slide deck will be sent out to everybody. So you can scan this QR code now. You can scan it later once this email gets out. So thank you. Dr. Smith will be on too for a little bit if there's questions that come up towards the end. And with that, we are going to do another drum roll, guess that price. One more round of guess that price of all of these items together. Without going over, Sarah always corrects me. We have some onesies and the Carter's, they're Carter's onesies. I think that's important. Wipes, wet wipes, and then we also have the nasal aspirator. So how much, without going over, do you think these three items cost? So we'll give you a couple seconds here. Get some stuff in the chat.
Jesse, going for it.
Jesse, woo. Let's see. Anyone want to try and beat out Jesse? Oh. All right. Are we ready to know? The total of all the items here that you see is $32.88.
So I'm just making sure.
I think we have
I
two.
think. No, we have
Two that
one.
did 30? Or did somebody do $31?
Oh, we do have two that did 30. Yep.
Oh, two winners that round. So please.
Brenda and Morgan, I will chat you.
Brenda and Morgan, congratulations. You both are winners. So just so y'all know, the Carter's 4-pack is $9. The wipes were $19.89. And the nasal aspirator was $3.99 for a grand total of $32.88. So again, congratulations to Brenda and Morgan. Go ahead and send Sarah your emails and we'll get you set up with those prices. So congrats. And now I would love for Tracy to come on the screen and talk to us about doulas and how doulas can make a difference in your pregnancy journey. So welcome, Tracy.
Hi, thanks for having me. My name is Tracy Dotson. I am the program manager for Doulas of Douglas County. We're a community-based doula program that's located in, you guessed it, Douglas County, which is Lawrence for maybe those who are more familiar with towns over counties. Home of the Jayhawks. Always love to throw that plug in there. So I guess I want to start with talking about what doulas are, because I often hop into the assumption that people know, and that's not always true. Before I started having children, I did not know what a doula was. I didn't have a doula with my first child because I wasn't very familiar with what doulas did. And by the time I was having my second, I was like, oh my goodness, everybody deserves a doula, which is why I do the work that I do. So doulas are trained non-medical professionals. So sometimes people think like, oh, I can get a doula and then like you don't have to have like pregnancy care or a doctor or midwife, and that's not true. We do totally different things. Doulas really focus on providing the physical, emotional, informational support that you may not get from your provider. So everybody here is pregnant or had a baby, and so you know that you go to your prenatal appointments. And in my experience, I spent more time in the waiting room than I did with my provider, and I had questions that weren't answered, or they'd pop up in between visits, and I wouldn't remember to ask them. So a doula would have been something very helpful for me to have known about, especially during my first pregnancy. The word doula actually comes from or is a derived from a Greek word that means a woman who serves. And so I think that that provides a pretty big umbrella for what doulas do, but it doesn't necessarily give a good picture for it. So depending on your specific needs, what your doula does or how they support you might look different than like your friend's doula or your cousin's doula or whatever it is. Um, and depending on what stage in your lifespan that you're in, you might have a different doula. So here on the screen, you'll see, I think we have what, 6 different types of doulas. There are more, but these are the ones that I focused on for this presentation. Birth and postpartum doulas are probably the most well-known. Like I said, we're a community-based doula program. So what makes us different is that we try to be low to no barrier, which means being low to no cost for our clients. Our program is funded by grant funding, private donations. Pretty much the bottom line is that families do not pay for their care. Also, that our doulas are a reflection of the community that we serve. So all of our doulas are mothers, caregivers. They've been through the birthing experience themselves. They are bilingual, things like that. They really meet the unique needs of the families here in our community. So I think doulas most often get associated with birth postpartum kind of community based, but I always like tip my hat off to the bereavement, end of life, and miscarriage doulas. Those are kind of the things that we don't talk about as much, but they do help families navigate really challenging things. Because sometimes pregnancy doesn't end with a baby, and that is something that can be a hard conversation to have, hard to navigate, really isolating. And so doulas stand by women and their families through those really challenging times. We can move to the next slide. And I think it's just a quote. Yeah. And for me, this quote special, it's really about like it to me, it really encompasses what doula work is. And this is for my style of doula. I will say that I encourage you, if you are interested in a doula, to interview different doulas, get to know people. We all have our different styles, as you probably know about prenatal care providers. Doctors have different styles too, and you should interview them as well, because you essentially get to choose who is a part of your birth team. And I think that that's something that doulas really empower people to do as well. I think as a society, we really fixate on babies and then mothers and their needs go neglected, which is kind of ironic. I think the essence of birth work and being a doula is really around nurturing mothers. And providing that support so that they can become the best parent and most self-assured, confident mother, father, whatever you identify as, that you see. And so I think that too, doulas, we don't come in with our own agenda. We really do work for our clients. We work in hospitals, in homes, in the community, but for you. And so we can move to the next slide. This is more specific to doulas of Douglas County. I thought it might be fun for you to see what our program does, and also encourage you to, if you're not located in our area, to look and see what's available in your area. And I think that Charlotte's group may be a good resource for that if you aren't familiar with the type of doula programs or supports that are available in your community. And that's also something that we can support and make referrals for too. But Doulas of Douglas County, like I said, we're a community-based doula program. Because we receive grant funding, or I'm sorry, because insurance does not cover doula coverage often, we do really rely on grant funding and private donations. Since 2021, we've been able to provide doula services and breastfeeding support. That's what we started as, and we've grown. So you'll see the other 4 areas are the parent-infant bonding project, our mom and baby basic needs closet, Brown Like Me infant toddler care, and then we do some community engagement. The parent-infant bonding project is one that I really got excited about. We had done that for 3 years. It was funded by the United Way for working postpartum mothers. Unfortunately, extended maternity leave is a privilege and not something that everybody can afford. And so many employers will offer little time off, but with that time off, it's often not paid or paid at a like really low percentage of what your actual wages are. So a lot of people get forced back to work really prematurely, and we know that that impacts your ability to bond with your infant. So our parent-infant bonding project allowed mothers to stay at home for up to 12 weeks, coordinated time off with their employer, and then we supplemented their income during that time. So that would look like rent and utility payments. It could look like a payment directly to the client, for whatever the difference of their actual expenses were, directly to them so that they could cover groceries, things like that. That project was incredibly successful. Obviously, a huge need in the community. Unfortunately, United Way has things have happened. They're merging. We're hopeful that when their organization has completed their merger, that we will be able to resume that project. Another thing that we offer is our mom and baby wellness closet or basic needs closet. That was something that we had already in place. We provided diapers, wipes, breastfeeding supplies, postpartum care items, things like that. But with the support of Healthy Blue, we were able to provide even more of those items, and then some larger, more safety like items like car seats and bassinets, things like that for baby care. Brown Like Me infant toddler care actually, within the last year, has opened. It grew from the need of, obviously, people are having babies and then they have to go back to work. So we had covered those 2 things. But what do we do for childcare? And that is something that I think everybody here can probably attest to, or at least know someone who has had a need for childcare, and it can be really challenging, and it forces people and keeps people in poverty. And so one of our doulas really stepped up to the plate, and she opened a her own in-home daycare, and she serves families that are served by our doula collective, or reserves slots for families that are served by our doula collective. She employs 3 other people, so she's able to have, don't quote me because childcare licensing is here, but I think 8 or 9 children in her care at any time. And so that's anybody that has been served by a doula with our collective can come back, or we love to make that transition immediately when they're going back to work. So infants and toddlers. And then the last kind of thing that we really do or are fond of is community building. We like to engage with our community and families as much as possible. We're at any type of event or fair here in our community that targets families. Last year during National Diaper Need Awareness Week, we partnered with Healthy Blue to do a diaper distribution, and that was available to everybody in the community. It was a really big hit. Had people like, are we going to keep doing that? When is the next one? And so we know, you all know, diapers are expensive. You knew it from The Price is Right. And so we wanted to be able to provide that support to our community. We also collaborate with other organizations on projects and events that are in line with our clients' needs and interests. We can move to the next slide. I talked a lot about our program, but what about doulas? Because obviously we offer a lot, but doulas in general, there is a significant benefit to having doula care. And so if you are a numbers kind of person and want to know how this impacts you, I think some of these statistics are worth really paying attention to. And doulas don't just provide support and guidance through the postpartum period or helping new parents adjust to life. Like, yes, these things are great. But when we talk about your physical health and well-being, doulas are really a big support in that. Studies show that having a doula present at your childbirth can really lead to shorter labors, less interventions, so like epidurals, pain medication, also higher rates of breastfeeding, and then just overall more satisfaction with your birth experience. Your doula really is going to advocate for you and support you through that, and whatever experience you want, they will work really hard with you to make that happen, or to identify, potential areas where you can advocate for yourself or work with your provider, anything like that. I think the first two boxes are worth paying attention to because that type of as far as the decrease in pain relief medication and shorter labors, when we talk about labor support, that doesn't just apply to doulas. I think that's where I tip my hat off to dads and partners and other support people, when they are there and acting in their role as a support person, they really can have an impact too. So I think that it just speaks to how important it is for you to build your support system. Whether you are a new parent, just had a baby, pregnant, now is the time. I think that it is, or actually I know pregnancy and postpartum can be really isolating, and doulas are a piece of it, but so are all of your family members, your friends, your doctors, midwives, and nurses. And so all of us make up your team and your village, and really should lean into that type of support. And if you don't have that type of support, I encourage you to start with a doula program like ours. My last kind of little plug is that it's important to know that we are not medical professionals. We do not replace medical professionals. If you have a doula who is like, yep, I'll be with you at home for your birth and no one else, find another doula. We really don't condone or endorse that type of doula work. We really would like to be a part of your birth team and working for you, wherever that is, alongside your doctors in your home with your midwife. Doula support is what you make it. Next slide is actually a video that I don't really feel like I need to share, but I will drop the link in the chat, or have Sarah drop the link in the chat, because it is it's like 6 minutes. But if you're a fan of Orange is the New Black, it's Danielle Brooks, and she is tasty and she's funny in it. But it also talks about like doula support compared to midwifery, and she uses a doula herself by the end of it. And I think that it's a fun video, so if you have time, check it out. The next slide is just our contact information. I think Facebook is most popular for people to find us, and then you get all of our other contact information. You can Google Doulas of Douglas County. It will pull every way to contact us. Call, text, email. That's all I have, guys. Thank you.
Awesome. Thanks so much, Tracy. Yeah, we'll put that link in the chat if Sarah hasn't already. And again, we'll send that out too in the email. So I'm sure it's an awesome video. That was great. I wish I would have used, I was just telling Sarah, I was like, oh, I had 3 babies and wish I would have had a doula with me along the ways. And one of the questions I had, Tracy, for you was, I had medicated births. I knew that was my birth plan, right? I wanted to go in and get except for my last, he came really fast and furious. And so I think, can you share a little bit more? Because this is what Sarah and I were talking about, how doulas can help and support medicated, those with birth plans that
Yes.
want the
Oh my goodness.
medication.
I
Yeah.
hope that I got that across, but if I didn't,
Uh-huh.
absolutely. So people, I think there is this like common
Yeah.
like
Misconception kind of.
yes, misconception,
Mhm.
exactly, that doulas, we're there and we're going to tell you to have this natural birth, get rid of the epidural, no medication
Yeah.
whatsoever. That's not true. Like, yes, that is a doula style, and we will support you if that's the type of birth that you want. But we absolutely all the time attend births where moms know, like, I want all the drugs. And I like, that is a quote. That's not my words. I quote.
That was
I
me
want
probably. I want it
everything.
all.
I want
Give me it all.
everything that I can get, all of the pain relief, and that is totally fine. We want to make sure that you are fully informed about what you are receiving,
Mhm.
and that is, we want to support that.
Right.
And then all at the same time, like, when is the time to start introducing those? So sometimes, and I'll start down my rabbit hole, but pay attention to time. Sometimes we can start some of those interventions a little too early, and it will stall out a labor, and that's where like the really long labors, which if it's your first, that's a chance anyways. But um, a piece of being a person who knows you want a medicated birth is, when do I want that medication?
Right.
And a doula can help you really
Mhm.
identify at what point that is,
Yeah.
how to get labor going faster, because that's something that everybody wants. We want to get it done,
Mhm.
regardless of how you're giving birth. So
Right. And I
that's something. And we attend births for C-sections. So
oh, nice. Yeah.
that is something also. I think people think because they are having a surgery that doulas
Yeah.
don't have a role, but we absolutely do, especially postpartum. We will come in addition to your medical team, who is going to take good
Yeah.
care of you, but we will come and make sure that you're settled into your postpartum room, help with like getting baby out of that bassinet thing, like all of those
Mhm.
types of things that your partner is there for too. But we know, like, dad has to leave and go get food or whatever it
Mhm.
is. We have other family members coming in to visit, and sometimes the doula can even play devil's advocate.
Yeah.
So it's like, hey, I'm noticing mom's overwhelmed, but she's not really ready to kick
Mhm.
people out. I
Mhm.
can be that bad guy and say, I feel like now's the time,
Yeah.
and let's
Yeah.
make that.
An advocate of all levels. Like, it's
Yeah.
amazing. So thank you so much for that, Tracy. This is great. And her contact information is on the screen. Now, last but not least, I would love to have Tanya come in and talk about how to find that quality childcare. So take it away.
Thank you. I'm happy to be here, everyone. I am Tanya with Childcare Ware Kansas, and we've heard some really great information from everybody. And I'm here to visit with you about how to find quality childcare. Childcare Ware of Kansas is a nonprofit organization that works with parents to help find childcare. So let me next slide. So we are a child care resource referral agency, and we do serve all counties in Kansas. And we have three main purposes. We help families find child care that fit their need. We help child care providers. We work alongside of them to help improve their program. And then we also work in communities to partner with them to kind of improve child care in their communities. So next slide. Here's kind of what our map looks like. So when I say that we partner with some partners across the state, we have three that we partner with, and you can see them here. The Family Conservancy, they cover kind of the Kansas City area. Child Care of Eastern Kansas, they're based out of Topeka and cover quite a few counties, straight north and south, north and south there. And then Child Start is in the Wichita area. Then Child Care of Kansas, as the state network, covers a lot of the rest of the state. But they all do the same thing. We all work with providers and communities, and then families to find child care. Next slide, please. So why quality childcare matters? There's lots of research about this. A child's brain is forming new connections every second, and taking advantage of this at that young age is so essential. Two things help shape the developing brain: genetics and experiences. And those happen in those first years of life. So whether it's at home with parents or in the childcare setting. And research shows that the vocabulary of a 2-year-old can predict their 3rd grade reading achievements. So we're going to look a little bit further into the brain development before we really get into the childcare. And I think if you'll click on the video, it hopefully will work.
I'm Dr. Elizabeth Kilby, and I'm a consultant clinical psychologist working with children and families. And my real interest, my passion, is working with under 5s and looking at the ways that they develop, what their strengths are.
Hi, my name's Dr. Sam Was. I'm a research scientist based at the University of Cambridge and the University of East London.
What really fascinates me is how young brains develop, because it's really tempting to think that a baby's brain is like a small adult brain, and it's really not. It's like a sponge. And their brains are developing at twice the speed. They're working through information twice as fast as adults.
So the brain is made up of billions and billions of cells called neurons. What happens in the first few years after we're born is that these neurons form this very rapid phase of development of their branches, so the branches that allow one neuron to talk to another. So it's like a forest coming into bloom. So a 2-year-old's brain has twice as many connections between cells as an adult's does. And then what happens in the first few years after that is that the used branches get maintained and the branches that aren't used get pruned away. So this is why it's really, really important that these early years, when all of these vital early stages of brain development are going on, during this time, we give as many different forms and types of stimulation to a young brain as we possibly can. Because all of the research suggests that this really has a big influence on which neurons get kept into the adult brain and which get pruned away.
What we worry about is if these connections aren't made, if this foundation is not there, this can affect children's learning and even their emotional development. And the consequences of this are far-reaching. It can affect them into adult life. We can all work towards giving children the stimulation, the interaction, the engagement that helps them develop. I can't think of anything more significant than giving young people the best possible start in life. And we can all do this. It's so achievable. And I wonder if we can really start to think about the idea that playtime, interaction, talking, sharing, that's brain time, that's developing, that's exactly the skills that we need. And we can encourage everyone to get on board with this. Think of the gift we're giving this generation.
Okay, so that's a really short video that talks about brain development. I just want to hit kind of point on a few things that they said. First, 1 to 2 million new connections are made in the first 1,000 days of a child's life. That is either days they are spent in childcare, if your child is being sent to childcare, or they're spent at home. And those days are so important. From 0 to 3, like they said, the brain is rapidly developing. And these are the times that we can foster those positive relationships with caregivers, with the community involvement, with the childcare provider, whoever the infant and child is staying with. And this is the foundation for lifelong health, intellectual ability, emotional well-being, and all of their social functions. So this is why quality childcare matters. You can see here are just a few indicators that really talk about quality childcare. And these are not all of them. You can jump to the next slide here. So it's all messed up, but that's okay. We're going to go with it. So, we'll jump through these so you can kind of see what they say. They're healthy meals, physical activity, little to no screen time, and rest time are available. These are some health indicators, health and safety indicators that we, number one, really stress that all childcare providers should be paying attention to, but all children need at a young age. We're lucky that some of our Healthy Blue funded some, had some funding for us to help childcare providers in these areas. When you think about healthy meals, making sure that if you're having to put your child in childcare, that they are getting a variety of nutrients, a variety of meals, because not one type of meal can get that for them. Good nutrition, growth, health, and learning, they all go together. Physical activity is really important. We all know that. That's why we say little to no screen time. Much of children's learning comes about through movement. If you don't know, if you haven't heard a lot about brain development, I won't get on my soapbox, but brain development really does happen when children are moving. When they get up and move, their little brain just starts to work and everything starts to click and they start to remember stuff. There's so many studies about this. And when it happens in those early years, that starts to build that base foundation that as they grow, it's where they go back and they retrieve that information and they pull it forward and it helps them. Not enough can be said about rest. It's essential for good health. And all of this comes together in those early years, whether it's in a quality childcare, and you want to make sure that these are being offered to them in those quality childcare programs. You can go to the next slide. Group ratios. So when we look at group size and ratios, this is really family preference. We don't have a form that we say, here's what you're going to go look for. When you find this, you have found the perfect childcare. It all comes down to family preference. What I looked for when my children were younger is definitely not the same that my sister looked for. When we lived in the same town, our kids didn't even go to the same childcare because we had different preferences. So staff interactions, space, what do you want that space to look like? Do you want them, what's the environment look like? When you're talking about infants, look from the infant level, what is the infant going to see? Is it appealing? Are they going to see different stuff? So it doesn't hurt, sit down on the floor, see what they're going to see. Does the child provider is forming relationships? Are they modeling peaceful exchange? Or how are they interacting with the other children? You should be able to go when they're have open hours with other children and a time when they don't, so that you can sit and talk to them. Make sure they've got developed appropriate practices and really look at those peer-to-peer relationship, not only with providers, but with the other children, and how are those handling? How are those being handled? These are all activities that kind of need to be looked at and are very important. Next, family involvement. So form partnerships and communication. This is probably one of the most important ones that you can look at when you're looking for quality childcare. When a childcare program, when you enter a childcare program, you enter a partnership with them. This is when family is created, and this is when your family starts to create that partnership. You are starting to develop that friendship with your child's other caregiver. So you really need to make sure you're on the same page with everything. The communication is very open and honest and very fluid. So you need to make sure, how do they communicate? Is it a way that you like to communicate? If your provider is really one that just only wants to communicate via text and you're like, I really prefer phone call, then you need to make sure that they're willing to use phone call and just not text. Make sure you understand the forms that you're being asked to fill out, and look at those forms and you understand everything that are on those. So make sure from the very beginning that you have the involvement that you want. It should be an open door policy. You should be able to come and go in that childcare program whenever you want. Licensed childcare providers have their license hanging up, so you should see that with the number of children and that they have and can have. So how do you find childcare? That's the big question. Child Care of Kansas does have the statewide referral center in the state. We have one telephone number, which you can see there, the 877-678-2548. That's the same number across the state that everybody uses. We do have bilingual resource specialists available, and then we have a language line that's available for any other languages. Our specialists do ask a set of questions that the child care list is tailored to your family needs. So if you call and say, I live in Salina, Kansas, and I need childcare, you're not going to get a list of all childcare in Salina. They're going to ask you a set of questions and tailor that list to your family needs, and then send you that information. You're going to get additional consumer education material. One of them we'll go over later, but it is a checklist that will help you to take on interviews. But one of the other things important that you're going to get is the KDHE Child Care Early Education Portal Online Facility Compliance Search. And I know that's a big word and it's up in red at the top. But that gives you access to the licensing history of childcare programs. So you can go in, type in the information that is on your list that we've sent you, and it will open up and show you what that childcare program, what the licensing, a surveyor that has been in there every year, what they have seen in that childcare program. That gives you kind of an indoor to their inspections. If there's something on there that you don't understand, because sometimes those regulations can be hard, you can call back to the resource center and ask them. You can call our office and ask us, and we can just say, oh, this is what that regulation means. This has been great because, as you know, newborn is very hard to find. I think Tracy indicated, that's a really hard a really hard age group. And we were very blessed to have startup funds from Healthy Blue in order to give to new childcare providers who want to come in and start a new childcare program. So this is, we've been able to open up some new slots across Kansas. Not everybody can do 20 or call the resource center Monday through Friday, 8 to 5, and we definitely know that. So we do have an online search option that is obviously available 24 hours a day. It's got Google Translate. It still has the consumer ed, and it's mobile friendly. And the next slide is a video that I will tell you, it doesn't look exactly like our online does. It's pretty close because we've made a few tweaks, but we're going to watch, and Dylan's going to walk you through what that looks like.
ChildcareWare of Kansas is here to help you in your search for childcare. Our online referral tool will help you find a licensed childcare provider in your area that fits your family's needs. We will show you how to use the search tool. In your web browser, open ks.childcareware.org. Click on Parents and Families and scroll down to search for your childcare. Then select Click here for childcare. The first thing you will do is enter an email address and password to create an account, or log on if you already have an account. You will need to fill out the information boxes in the My Account tab before starting a search. Make sure you complete the boxes with an asterisk. At the bottom of this page, you will then hit Add New Child and complete the information boxes on the children you are seeking care for, and click the Save button. After you've completed your account, make sure to hit the green Save button. To search for a provider, select the Search for Programs tab at the top of the page. You will see the Search Basics over to the left side, and the Find and Type tabs. You can choose the types of programs you are looking for, as well as proximity to an address or school. After you have made this selection, you can then choose More Details to filter the results down by ages, days, and hours the care is needed. Once your selections have been made, hit the Find button at the bottom of the search box. This will generate a list of providers who have openings in the CCA system. If you had no results, you may want to limit your details and search again. After the list of providers is generated, you can view more detailed information on each provider, including their contact information, business hours, messages to families, and their license number.
Click on the Child Licensing Report to inquire about past inspection. Clicking the More Information button will provide you with more detailed information specific to that provider.
You may also refine the search results even further on the left-hand side. Once you find a provider you're interested in, you can click the folder with green plus to add it to your favorites file. To view your favorites, select the My Favorites tab. You can view your favorites and compare, share, and print. After you have selected providers that fit your needs, please contact them and schedule a visit. We have lots of resources to help you select a high-quality program that suits your child's needs. Please click the Consumer Ed tab at the top with more information on what indicators to look for. The search results are referrals and not recommendations. If you would like additional information or help with your search, our resource specialists are here to help. Please call us at 877-678-2548.
As you can see, that also walks you through kind of just like our childcare resource specialist will. The checklist I was talking about would be sent, that is previewed here. We just want to remind you to schedule an on-site interview, ask questions, look from your child's point of view, and check that they're following basic health and safety guidelines. And this checklist is a printable checklist. It's on our website. You get it with a referral. It's on where Dylan said, you know, that it, you could check for more commercial consumer ed. This is something that it's free. You can print it off, use it as often as you want. But if you are looking for childcare, we do encourage you to make sure you choose a checklist like this or any kind of checklist, so that you can take this and kind of take notes to find the best childcare for you. If you have additional questions, here's an email to our office. Or I can take any questions if you need to.
Yeah, thank you so much. That was awesome. I have used the resource before in Iowa with my 3 kids and getting daycare set up and everything like that. So thank you. Sarah has been monitoring questions in the chat, and I don't see any right now, but feel free to add those as we have them. Thank you all again for that, for all your information and education for everybody on the call today. Before we end today, I wanted to share some 3 great resources available to you. 211 is a number you can call to get access to resources near you and learn all the ins and outs of how to go through the process of getting those resources and help. And then Safe Kids is also a great resource. They're the certifying body for car seat technicians and have a tool to find a car seat tech near you. We all know how hard it is to put in car seats nowadays. So feel free to look that up and go find that car seat. It's completely free, which is an amazing, amazing resource. And then I also wanted to share the Earth app. Earth is a free app where people can leave reviews of birthing hospitals. So this is somewhere you can learn about hospitals near you or leave a review of your own experience. And then, of course, one last reminder before we share more about the prizes that we're giving away today. Don't forget to download the free Count the Kicks app. And so just so you all know, we will be doing a drawing for a pack and play. So if you do receive an email from my colleague, Christine Tucker, or Sarah Hybels is their name, please respond in a timely manner. If you won the pack and play, you'll get an email with that information. And then we also will be giving away Amazon gift cards to everybody that attended today. So congratulations, you're at least getting an Amazon gift card, which we're so excited about, thanks to this partnership with Healthy Blue. And so in the next couple of days, you'll get a post-webinar email that will have all of this information in it. We'll share the pack and play winners with those individuals to get more of their mailing address, and then you'll all get your gift card. So look to your emails for that and all of that, the recording and everything there. And again, thank you so much to everyone in the audience, to all of our speakers today, to our amazing contributors for this event. You know, everybody from Healthy Blue, the Kansas Birth Equity Network, Doulas of Douglas County, Child Care Aware. Thank you all, and congratulations to everybody on the call with their pregnancies or their babies. This is an exciting time in your life, and we wish you a wonderful, joyous experience in your pregnancy and labor and delivery. We have a couple minutes left, so if you have any questions, feel free to put them in the chat. Otherwise, enjoy the rest of your afternoon and happy holidays. Thank you, everybody.